In your morning medical news, a new COVID shot is here, but most people can't get it. After weeks of delays, the FDA finally approving Novavax's protein-based vaccine. Unlike the mRNA shots from Pfizer and Moderna, this one uses more traditional technology, but there's a catch. It's only available to seniors 65 plus or those 12 and older with high-risk conditions like asthma, diabetes, obesity, or pregnancy. And that age-old advice about never going to bed angry, well, sleep experts say you can forget about that. Clinical psychologists warn that forcing late-night conflict resolution often leads to rushed conversations that miss important emotional needs. Research shows a good night's rest actually helps our brains reset, allowing for more thoughtful communication when we wake up. If you're too upset to sleep, experts recommend setting a specific time for a follow-up discussion to help calm your racing thoughts. And it can cause abnormalities, even death, to newborns. And health officials say the number of congenital syphilis cases is climbing to the highest number the U.S. has seen in decades. But new recommendations are aimed at lowering those numbers. Mandy Gaither takes a look at the new guidelines and how early diagnosis can save lives.
It's a concerning trend. Cases of syphilis are spiking in the U.S., and if left untreated during pregnancy, the infectious disease can be passed down to the fetus.
In the past decade, it's been a tenfold increase in congenital syphilis.
In 2023, nearly 3,900 cases of congenital syphilis were reported in the U.S. That's up from just over 330 cases in 2012 and includes 279 stillbirths and newborn or infant deaths related to syphilis. Researchers say that's the highest number reported in more than 30 years. Not only can it cause death to the newborn, but also premature birth, low birth weight, deformed bones, anemia, enlarged liver and spleen, jaundice, brain and nerve problems, and meningitis.
Syphilis is preventable if we have early diagnosis, early and appropriate treatment.
Cleveland Clinic OBGYN Dr. Tosin Goji says syphilis can be treated with penicillin, but it has to be diagnosed first. She says it can be asymptomatic, so there needs to be a blood test. The U.S. Preventive Services Task Force released recommendations calling for early universal syphilis screening during pregnancy. And for those who don't get screened early in pregnancy, the task force advises screening at the first available opportunity. Goji says patients at high risk of contracting the disease should also get repeated testing throughout pregnancy.
The doctor says some reproductive age women in certain racial and ethnic groups are at an even higher risk of syphilis and therefore congenital syphilis. So she says it's important to focus on these groups, making sure they have access to screening and treatment.